And we're going to start our Workers' Compensation Wednesdays for June 2026. Let's get started. So if you have attended any Texas Association of Counties presentation, training, otherwise, you'll know that we always talk about disclaimers because we cannot provide legal advice. Now, I'm a professional workers' compensation adjuster licensed through the state of Texas. I can competently talk about the statute and the administrative code associated with workers' compensation. I cannot speak to personnel issues, anything involving human resources, and that is the reason for those of you who've had the opportunity to work directly with me. I so heavily rely on our HR consultants, but none of the people that are associated with the Risk Management Services Department at TAC, none of us are attorneys, and therefore we will always recommend that you speak with your own county attorney or a competent attorney than which you rely on for legal advice on any of the topics which we're talking about today. So this is probably driven more to those people who have not been involved in any of the training. What is worthy? Why do we have a Workers' Compensation Wednesday discussion once a month? We have a lot of topics. Workers' compensation isn't necessarily complicated, but it is very complex. There's just so many layers that affect how your benefits, all of you individually have benefits, as do your employees. And so in order to be able to give you a broader educational scope on how workers' compensation works and connecting those dots, we thought it was a really great idea. And I'm going to give Lee, who is our host today, who didn't even introduce herself, Lee Bell Hovland, who's involved with our risk management. She kind of keeps us all going in the right direction when it comes to presentations. Give her a lot of credit because although we had these ideas of how we get this information out to you, she is the one who actually structured and helped us present this webinar today. So I want to give her my gratitude and thanks. So workers' compensation, of course, can be complex, and I made a list of just a few of the elements of workers' compensation that can throw a wrench in our mechanism here. So it's, we have to deal with pre-existing medical conditions. We have an aging workforce. It's going to be naturally, we're going to be bringing a lot of conditions to the table, but we do take our employees and our claimants as they are when they have the claim. Intervening injuries. We've got people who may come back to work, have an intervening injury, or just in life they might have an injury which may impact their claim, and we have to be cognizant of that as well. Legislative mandated administrative requirements. All of you probably familiar with that in every aspect of your life if you're working in county and local governments. And of course it does affect workers' compensation as well. Workers' compensation is a very sexy topic for our legislatures. They get a lot of traction in social media and print media and all media regarding their work with first responders. So we're going to be talking about first responders quite a bit as well and how that impacts our workers' compensation program. Benefit delivery deadlines. Not only do your adjusters have benefit delivery deadlines, they rely on the things that you do in order to meet those deadlines as well. So we'll be talking about that, and we'll also be talking about forms. We may not hit every topic every month, but if you're able to have the opportunity to attend on a monthly basis, you'll be able to get the full scope of what we're trying to accomplish with this presentation. So our objectives are to cover these topics that are on your screen. Today we're going to talk a little bit about coverage and how coverage is impacted by what you do in the workplace to make it safe. We are going to talk about first responder claims. We're going to start talking about presumption, and then we will be talking about a little bit about what's going on at the Division of Workers' Compensation. I have a trending topic that I'm developing for next month that is going to involve wearable technology and how that's going to impact the workers' compensation industry in the years ahead. It's going to be very interesting, but I want to pull enough information to make it an interesting topic for you and to give you some idea of what the future holds for our programs. So today's agenda is we're going to talk about the risk of no-fault coverage. Workers' compensation is no fault. You are required to carry workers' compensation as a public entity, but the no-fault coverage in itself can cause some problems. So we're going to talk a little bit about how we manage really simple risk. This is kind of an insurance one-on-one topic. Secondly, we're going to talk about first responders. I mentioned we're going to talk about resumption claims. We're going to talk about really the definition of presumption and how it really started in the workers' compensation system. For those of you who are heavily involved with working first responders, particularly law enforcement and firefighters, and we have an emerging firefighter risk because we've got more and more counties who are actually develop professional firefighting programs within their county lines. This should be a topic that you should be aware of. And then finally, we're going to talk about the DWIC 73 and how to utilize that, maximize your use of that disability report from the treating doctor, and how it should be completed, things that you can do to make it better for you, and how you can leverage it from a return to work situation. And then each week we'll talk about DWIC, the Division of Workers' Compensation updates. Okay, so workers' compensation coverage. Baseline workers' compensation provides medical and indemnity benefits to your employees if they're injured in the course and scope of their employment. Now, this is no fault coverage, and this is really what we're going to focus on early in this presentation today. This no fault coverage, the employee could be at fault, the employer could be at fault, a coworker can be at fault, it could be an idiopathic injury, which means really no one's at fault. It's just something that happens. It could be a motor vehicle accident. Anything that happens, there is no assessment of liability. So there's not a liability component on whether or not someone receives workers' compensation benefits. Compensability can this claim be paid is associated with meeting the criteria of whether it was occurred within the course, when injury occurred within the course and scope of employment and meets those definitions. So essentially it's no fault. As such, we have safety issues because an employee can receive benefits and not really be compelled by safety requirements or anything that you might have within your county or organization that might compel them to be safer. And so that's what we're going to talk a little bit about in a few minutes. And then, of course, the third block there refers to that an employee must be disabled for 8 days before they can receive the indemnity benefits at 70% of their average weekly wage prior to the injury date. So workers' compensation coverage really falls into those three blocks, and then the complexity of the program the program overall will actually spread out from those three blocks. The Division of Workers' Compensation, and I'll refer to that as DWIC moving forward in the presentation. They actually operate the Texas Workers' Compensation System. They are a division of the Texas Department of Insurance, and they are empowered. That's a very strong regulatory component of the TDI. They can enforce compliance with enforcement actions, and they can make sure that we're in compliant with the Texas Work Compact, the Labor Code, which is where you're going to see the statutes, and then the administrative code, which is actually the conditions and really like a policy for how we're supposed to handle the workers' compensation, and those have to be strictly followed. The Division of Workers' Compensation has strengthened itself steadily since 2005 when it actually blossomed out of the Texas Workers' Compensation Commission, which formed when the Workers' Compensation Act was put in place on January 1 of 1991. And it is powerful. The Texas Department of Insurance is a consumer advocacy organization, and so we are increasingly focused on compliance issues. I believe many of our member contacts who's been working with workers' compensation this year has seen an increased request and maybe a little bit of panic from some of the adjusters about getting wage statements, post-injury wage information, things like that. These things are being required by the Division of Workers' workers' compensation, and we have to be compliant. We have professional licenses which can become under scrutiny with the Texas Department of Insurance, and they can take action against an individual adjuster for failing to be compliant in their duties. So we of course, we request that that you have patience and a little bit of empathy for the adjusters when they're trying to get information, but at the same time, they are required to be compliant and be transparent with you about when they need something from you. So just back to regulatory compliance, these bullet points address that specifically. Just wanted to point to the last bullet point. Compliance and investigation has 3 areas, and this is from the DWIC point of view. They have audit and investigations, they have enforcement, and then they have the DWC audit unit. Audits, you may have been contacted by a member of an audit team regarding a ongoing lifetime income benefit and death benefit audit, which has been going on for the last 6 to 7 months. This audit has required many of our members to go back and redo some wage statements because they're looking for a specific compliance bar, which is very high standard right now for completing those wage statements. So that's part of the audit department. We have a lot of investigations that go along with any times the bills are paid late or there's late payment of indemnity benefits, and those are handled relatively routinely, but there is a very formal process to deal with that, and consequences can be a penalty or a fine, and that actually comes from the enforcement part. The interesting thing is the DWIC fraud unit, they've been very actively pursuing issues with healthcare providers. I've seen that they've been focused more on that this year than ever before, but there is a fraud unit that actually focuses on injured employee fraud, and we're going to talk a little bit about that as well this morning. So first, we're going to kind of do an insurance 101, the difference between peril and hazard, and then we'll talk a little bit about fraud. So you know, in your role in a workers' compensation environment, you know, we want to avoid claims from ever happening. That's the reason it's so important that you work with our loss control consultants or risk management consultants. Each region has a team of consultants that includes your risk management consultant. They're kind of your overall all risk, making sure that you've got the right coverages in place, how you do contributions. They work with your member service reps to give you that, almost like if you had an agent, an advocate with the Texas Association of Counties Risk Management Services Group to take care of your individual program. Your loss control consultant, of course, is going to work with you on how you can install good safety measures to mitigate your losses, whether you can avoid them completely or how you can mitigate the severity of them. Essentially, try to get them from ever coming to my attention in the claims department. And then you have a law enforcement consultant, and of course you have your HR consultant, and they're going to work with you on your professional liability and personnel issues associated with those programs. And all of this is to mitigate your exposures, which is your perils and your hazards, and whatever they are unique to those coverages, and ensure that you've got a healthy program. It's going to be very difficult. We have some counties that never have claims. They just don't have claims. They don't have a lot of employees, or they just don't have the opportunity to have a claim. But the risk is certainly always going to be there for them, and that's the reason they're required to have this coverage. So, but it is good to understand that there are some really basic things that we need to focus on, not just the high level things, because if you forget the little things, then that's where you're going to kind of lose traction on your loss control program, and you may find yourself with a serious claim. So the first thing we're going to talk about perils, and that is the possibility of having a loss of injury. I think across the board, each one of you who have coverage for workers' compensation in the pool recognize that there's a risk. Every time someone gets into a car, every time somebody walks out on a flat floor, every time somebody walks down a pair of stairs, you're going to have a risk for a potential claim. Sometimes it doesn't matter how careful people are going to be, but you have to look at what you can impact from the environment. So it's the possibility of a loss of injury, which can actually be a peril. Now, perils can be very obvious. I mean, this is an example of this is obviously a place you really probably would be very, very careful to walk around in. This is a house of peril. This is an AI generated image, obviously, that I pulled, but you can just look, just go from corner to corner throughout that, going from roof to floor. You can see how many perils would be. What would you step on? What would fall on you? What if would you shift something? How would you let your employees actually walk into that environment? If you had to, if this was a post uh, storm problem, say this was a result of a hurricane that impacted a warehousing unit on the on the coastline, or a tornado anywhere else in Texas, you would have to send people in there to get that repaired. I mean, how would you clean it up? You have to think about what's the underlying concerns. Yes, you need to get it cleaned up, but how are you going to keep people safe as they're trying to work that loss? Then there's hazards. Hazards are like, it's like a banana in a box type of situation. I think when we actually illustrate hazards, we tend to go to bananas and we tend to go to boxes because those are the obvious things. It's the source of the danger. It's the hazard. So while bananas are frequently used for slip and falls, for those of you who've ever worked in the grocery industry, you'll know that it's not bananas, it's grapes that's going to get you at a grocery store. But it's the effect of the unpredictable and the unanalyzable. It's the forces. It's those things that cause change in your risk. You know you've got the peril, but what can you do about removing the hazards to keep that peril calmed? So you have what looks like a very orderly room, much different than that perilous room that I showed you a couple of slides back. Are there perils in there? Certainly there are. There's a box that's sitting in the middle of the floor. There's a couple of boxes that are kind of askew and not properly located. You've got some furniture that's pushed back against other furniture that might have to be moved in order for you able to gain access to some of the boxes that you might need. So there's going to be hazards even in a very orderly manner in a room like this. These are the type of things that you need to be looking at in order to avoid your workers' compensation claims, so those claims never get to my team. Now, those hazards can bring something along the way. You know, you can have a really nice, orderly environment, but if you discount those hazards and you make them kind of a daily grind, and you're not constantly renewing the need for making sure that you're staying on top of it, you can essentially cause things like a physical hazard. You leave a box out in the middle of the room like you did in that orderly room, or you could have a morale issue when you just start disregarding the need to stay on and making sure that hazards don't continually develop. You know, we sometimes we can get complacent in our work environment, and as complacency grows, morale starts to ebb back. It tends to start dropping. This is something I think for those of you who are in human resources and do personnel issues, you know, you're constantly doing training, you're doing employee uplifting, you're doing things like that. Well, everyone needs to do it from the top of the bottom of your organization in order to make sure that people are still on their toes regarding to make sure that their environment is safe. Because if you becoming complacent and that morale gets low, there's going to be an opportunity for a hazard to actually create an environment where you can have a claim with something that could have been completely avoidable. Morale can also be impacted when you're dealing with some personnel issues, and you'll have people who actually are disregarding safety requirements. And that falls more into the personnel and the human resources aspect of it, and how you handle discipline and how you handle supervision. But those need to be looked at as well, because when morale issues actually begin to seed into into the workplace environment, you can open up an opportunity for additional workers' compensation claims. And when those happen, it's like you've already poisoned the well, because if you have a disgruntled employee have a workers' compensation claim, the motivation to get back to work is also sometimes affected as well. So it's important that these type of topics are covered in this forum. The last thing is morale. When morale is moral, I'm sorry, we've already talked morale, morals. When everything tends to drop into a big black deep hole. Sometimes the moral aspect of people working can actually go into a dark place as well. And it's more than just, I'm going to take a pencil home because you owe me. It is going to be more into the lines where, you know, we have to kind of get back of our employer, or we're mad at our employee, you know, we're mad at our employer, and it might take some area, go get into some gray areas, which can impact an insurance program or a coverage program like you have through the pool. And that's where we get into the discussion of fraud. And this screen, this is actually something I presented at the Treasurers Conference about 2 years ago, talking about risk. I had talked about fraud and how it impacted the financial aspect of the county. But it impacts more than that. This information was derived from the Division of Workers' Compensation, that they define fraud specifically as occurring when someone willfully makes a false statement or conceals information to obtain benefits or prevent someone from receiving benefits to which they might be entitled. This statement applies to someone who might be injured, or to anybody around that person who was injured, that might either frame it so that it's advocating for that employee, or is framing it to be against the employee who was injured. So when you're doing your internal investigations, when you're talking to your employees and doing your root cause analysis, we always want to be used as much diligence as possible with your internal investigations. Be as objective as possible. Try to remove bias from the equation of your investigations to ensure that you're getting the best story. And sometimes what you're missing, if you have a question about something and you don't have clarification, what you're missing may be just as important as what's being shared with you, because that information is also being shared with the adjuster, and that's the platform that they're utilizing to do their investigation. If that information that's coming from the employer, which should have the best knowledge of how that claim occurred and how that employee is actually, you know, how that employee works and how reliable they may be and things like that, you can kind of get off the rails very, very quickly. So keeping in mind that fraud doesn't happen very often. It is not something that's in the, you know, when we talk about fraud, we're looking at somewhere between 90, you know, the less than 5% up to 2% in workers' compensation in the state of Texas. And I think it's actually lower for that in public entity, because our counties tend to have a more familiar atmosphere to how they handle their employees. Is something to pay attention to. We look for secondary gain. The comment on the screen that says fraud is usually motivated by greed, that has to do with secondary gain. That could be a secondary employment that hasn't been shared with, you know, with the adjuster as far as post earnings income. It could be anything that they could to try to gain some sort of system advantage. Unfortunately, society tends to be a little bit accepting of that right now, but from a compliance perspective, it's not accepted at all. So employees who would not normally engage in criminal behavior may commit workers' compensation fraud, because the list on the screen, they perceive it as a victimless crime. They think of it as a faceless insurance company. I don't know if we do as good a job as we should about explaining to employees that you're a member of a risk pool that involves other counties, other public other public entities, and that we pull the money together in order to have our claims and to be able to pay them, that we're actually utilizing taxpayer money in paying these claims. Now, is that to make an employee feel bad or feel that they shouldn't receive the benefits that they're getting, and they're not entitled to their maximum benefits? No. The coverage that you are committing to by sending your contributions allows entitlement to you and to your employees, and any of your injured employees that are currently receiving benefits, the maximum benefits offered under the workers' compensation law, which is state law. What we want to do is make sure we're doing it correctly. And we don't want to underpay anybody. We don't want to overpay anybody. We just want to do it the right way. I do believe that if employee recognizes that the employer is committed to that process and understand how the process works, they will connect the dots and be a little bit more cognizant of where their role is in making sure that that is a successful program. I do believe that there is a societal view against insurance companies right now. So if there's a any perception that they're getting their benefits through an insurance company, that actually puts us at a disadvantage. So when that message is important, I try to train our adjusters to make sure that they understand how the pool works and making sure that they're reminding them this is a risk pool and not an insurance company. This also makes certain that their claims are actually going to get probably a higher degree of attention. Even if you don't necessarily get the adjuster that you want, or you're feeling like you're getting your service that you need at the claim department, I will assure you that anything that's brought to the attention of the Texas Department of the Texas Association of Counties Risk Management pool, the services through our service group, will make sure that we get that right. And I think that's just part of the culture of our program, and we want to make sure it bleeds down all the way to every claim that's for our members. But going back to the bullet points, they think that they can inflate and falsify claims fairly easily. They don't think they're going to get caught because it's a bureaucratic system. That's probably a true statement. They don't think they can get caught, and probably a lot of people are getting things that maybe they don't need in the program, or they're missing days at which they should be back to work. We just need to be diligent in trying to make sure that we can curb that as much as possible. And they see it as a quick and easy way to make money. You're not going to make a lot of money in workers' compensation. Um, the information that we're being provided by you through our wages are not, they're going to get it. Where the issue is going to be is disability and having them come back to work. And I think the communication that we have with our members, and then trying to keep tabs on our member employees will help us with that. We're not in a jurisdiction where we get settlements, and I think that probably drives more to the settlements. But I do want to recognize that it is expensive. I mean, the Coalition Against Insurance Fraud says there's about $80 billion annually, inclusive to all coverages, that were fraud, will arise. Workers' compensation tends to be something that they point to a great deal. I think in Texas, we've put a lot of benefit. Our benefit program built through the Texas Department of Insurance is probably pretty viable to keep that fraud out. But I do think it needs to be aware on your mind that even simple statements can have a lot of weight on how we drive a workers' compensation claim. And remember, it's not a victimless crime, because if we're spending more of your money, it will translate into more contributions that you have to pay in order to be able to keep the pool sustainable for paying claims. And we've got a pretty good deal going here with our members, and the fact that we're able to kind of keep it all within our county local government realm. We're not actually being penetrated through other programs that an insurance company might be handling that may impact what you're having to invest in the pool. So we want to work together on this, and this is why I wanted to share this portion of the kind of like the first layer of work on a workers' compensation program has to do with what our loss control people do at their level in order to set the platform for you to have a good workers' compensation program. So we're going to switch gears here and talk about first responders claim real quick. We're going to break this up. We're specifically talking about presumptions. Workers' compensation claims work exactly the same way for all employees. Everybody that's considered employee under workers' compensation, and that includes those optional employees we talked about last month. That could be volunteer fire departments, jurors, your reserve deputies, your election personnel that are not employed by the county. If your county chooses to employ those, that includes your elected officials, even though they're not considered employees under your standard employment work. Under workers' compensation, they can be classified as employee for the purpose of receiving benefits. So if you have a part-time worker, a seasonal worker that might be working for you, have an intern that's actually covered under optional coverage because you've got all volunteers, a sheriff deputy, a reserve deputy, that is because you've got volunteer law enforcement, you're paying contributions for those optional coverages. Everybody that's under that banner as an employee for the county as a member for local government, they will be handled exactly the same way for all benefits. The only thing that changes is with first responders, with a couple of statutes that impact them that are a little bit different. We're going to talk about each of those over the next few months. Today we're going to start talking about presumption, and this is the one thing that's probably the largest. Presumption only applies to first responders. In the last two sessions, they've expanded presumption from law enforcement and firefighters to include some other, and we're going to talk a lot about that in just a few moments. And they've expanded it. And so we're going to first start talking about what happened in 2025 in the legislature regarding rebuttable presumption. So Texas has rebuttable presumption, and that means if an employee qualifies for presumption, and right now it's going to be peace officers, under the definition of peace officers under the government code, certain claims, once they're filed, it is presumed that they have a compensable injury or illness on the onset. Now, in standard insurance claims and with workers' compensation coverage that you've got on your program, it is presumed that there's not a presumption in place. The employee has the burden of proof to prove that they were injured in the course and scope of employment. So you have to weigh the evidence. The employee has a responsibility to make a statement, and they can do that by writing a statement or helping you fill out a first report of injury. They're making a statement that I got injured, and then the response is, well, then how did you get injured? It runs back and forth in your investigation to make a determination on whether you got enough evidence to accept a claim. But the employee has a requirement to put forth their burden of proof. Now, they can do that with showing that, I have a broken arm. I've got a broken arm, therefore I'll be able to prove up my claim. They can do it through medical records. They can do it through a statement. They can do through responding to investigation requests, things like that. But if you've got a presumption claim, your employer is back on their heels already, because all the employer has to say is, I'm filing a claim, and then they can be quiet. Then the employer has to prove that that claim didn't happen, or that the injury didn't happen, or it's not related to the work environment. And that's really a hard task on presumption. But it is rebuttable, because once we gather information, we can dispute the claim, and then we push it back to the employee to respond. So we do have an opportunity to start our investigation, gather the information, take a position, and then we can have a rebuttal back and forth under the guidelines of the Workers' Compensation Act. So that's what presumption is. From a legal perspective, it's difficult. From an adjusting and investigation expectation, it is a nightmare. Because you're having to weigh how the investigation is going to impact the claim, and you're really pushing back with pulling your evidence together, and sometimes that evidence is not easy to get. Now, we do have a rebuttable format that's established by the Division of Workers' Compensation, where we have certain information we have to file. We have to be transparent with our investigation, list out exactly what we have and have not done in order to gather the information before we might be forced into a situation where we have to pay benefits. So what is different from a rebuttal presumption to a non-rebuttal presumption is that there are some states that are actually creating a legislative atmosphere for non-rebuttable presumption that basically says that if I'm a law enforcement officer and I have a heart attack at work, we're going to presume that it is at work, and we're going to discount any elements that says it's not at work, and we're going to pay for every single heart attack regardless of the circumstances of that of the heart attack. So if you have someone that has a significant history of heart condition, all the things that go along with it, you would not have a chance to deny the claim. Now, we're not like that in Texas, but there's some states that are moving that direction. So it's important to understand that that's on the horizon, because you can see how that might impact your risk for underwriting if we went into that territory. So under the government code, and this is specific, I want to make it look like that, I knew what I was talking about here. We're going to talk a little bit about how the presumption kind of started to leak into how workers' compensation works. So under this government code 607, you're going to see a subchapter for contagious diseases. So those of you who actively handle workers' compensation claim, particularly working with the jail environment, know that we have communicable disease exposures. Now, we're actually not even going to talk about communicable disease exposures today. We're going to talk about the first ones they brought to the plate. And so going to the next screen, before we get to that point, I jumped ahead. I want to talk a little bit about what the last legislature did in 2025. They expanded the peace officers to include justice of the peace, death investigators, and the medical examiner's office. So if any of those, the justice of the peace, the death investigator, medical examiner office, and if any employees in their offices that are actually doing an investigation in death, like at an inquest, they could be covered under the presumption as well. That was where the expansion on police officers, peace officers were, that included law enforcement, jailers, firefighters, anybody that might actually have to deal with maybe a body remains of a deceased or anything like that, where they might actually be exposed to contagion. This actually probably came out of COVID, because there wasn't things in place for these actors or during COVID to protect them during that period. And so they have been added to first responder presumption specific to death investigations. So if you've got county employees that are associated with the medical examiner, the justice of the peace who might be doing investigations, you could actually have to look at them as a first responder in those scenarios. Okay, so I'm going to get back now to what my train of thought was regarding the contagion diseases. So this actually started with tuberculosis and actually, it was with tuberculosis. Concern about tuberculosis, and this goes back to the 1960s, is that if you were exposed to tuberculosis, how would you handle it under a workers' compensation environment? So if you have an employee who was exposed to active tuberculosis, particularly in the jail, I think 20 years ago, a lot of claims were filed. We haven't seen a lot of claims filed in the last 20 years because there had been some sort of TB had subsided, I think, in Texas, but now we're starting to see an upswing to it again. I've had more calls on tuberculosis this year than I have in the past. So if you're exposed to contagious disease like tuberculosis, you could be entitled to composition. First of all, the disease is not considered an ordinary disease of life. So the flu, colds, things like that, that's not going to be considered a contagious disease. COVID's not considered it anymore because as of June 13th, 2023, they actually took that off of being a requirement for presumption. But tuberculosis is not considered an ordinary disease of life if there's an exposure in the work environment. So tuberculosis, of course, is going to be something that we need to be looking at claims moving forward. So if you have a situation where you've got tuberculosis identified in jail and you've got people who are exposed in a manner in which you think that there might be concerned, then of course a claim may need to be filed. So that exposure has to be within the course and scope of employment. If we do find when someone says that they have active tuberculosis, and then we actually do some testing on them and find out they have latent tuberculosis, which means they might have had TB in the past, that will probably nullify their claim. But again, we have to explore that. Talking about the death investigators on the previous screen, if they've been conducting or assisting in the inquest for death investigation, they could actually be considered under presumption as a first responder. If the employee requires preventative medical treatment because of exposure to the disease, that might actually bring in, and then we're going to talk a little bit about an unusual situation on that is someone who's exposed to rabies. So if you have someone who was working in the animal shelter and they might be exposed to rabies and required to have the rabies shots, um, there could be an opportunity, a window to bring them under this presumption as well, because they're required to get that preventive medical treatment. We do see I wasn't going to talk about communicable diseases right now, but under the communicable diseases, we will see injured employees having to get the prophylactic injections for exposure to HIV and hepatitis. And so it would kind of fall under this bullet point as well. And so the employer is required for compensation for this. Now, the government entity employer, so for example, if you had an exposure that included maybe some municipal employees or state employees, their compensation would be covered under their own workers' compensation programs. However, if you have a death investigation professional, and it could be any death investigational professional, it doesn't matter what public entity that they work for, you might end up having to pay under your workers' compensation program any type of compensation for post-injury vaccinations and things like that. That's very highly unusual, but just be aware that there is a small window that an employee of maybe a municipality, maybe, you know, if you're your county seat and you're doing an investigation internally and you've got a local police chief or a member of their staff that's working on an investigation with someone with your JP's office or something, you could actually have some cross coverage there that we would have to talk about. So we're looking at 4 elements here which you could have issues, and that would be smallpox, tuberculosis, and other respiratory illnesses. The respiratory illnesses were kind of heavily pulled in because of COVID, which is now excluded, but they're kind of hedging their bets if something else pops up that we may have to look at it in the future, and they've got some legislative support in there already. But this actually all started with smallpox and tuberculosis. Not having been monitoring anything involving smallpox exposure in Texas right now. Of course, we're always putting our eyes to the border when we're looking at these emerging diseases coming across the border. So, but it can happen anywhere. I mean, it could happen anywhere in the state of Texas where you might have a smallpox exposure or tuberculosis exposure. These are emerging where I've spoken with our defense counsel about how we defend them. So we really don't have a clear path on how we're going to defend these type of cases. So when those cases come up, I would ask that you contact me directly on these so that we can have a conversation and make sure that we're taking care of your employee and we're also defending you as well on the cases that we should not be paying for. I've got on about 15 minutes. I want to talk a little bit about DWIC 73. I think we should be able to get this in. Each of us, you know, I hope everybody knows what DWIC 73 is. It is the disability and return to work report that we utilize with treating doctors in order to be able to effectively manage return to work. So if you're familiar with the work status report, I know this may look awfully small on this screen, so you're going to have to put your nose to your computer screen a little bit, but I want to talk a little bit about how it's actually completed. The treating doctor is required to complete these every time that they have an examination. Now, if you're if you're utilizing as a mandatory network requirement for your employees to treat with our alliance physicians, the alliance physicians are actually trained on how to complete these forms. And if they're not completing properly, I need to know about that because I do see some element in most forms that are missed, and you have an opportunity to push back on that. This form is actually to the benefit of the employer more than the adjuster. The adjuster needs the DWIC 6 from the employer so that we know whether someone has come back to work or not. But the form itself is actually for the employer. And when you look at the form without, you know, it has going to have all the employee information on there. But over on those fields for on the right side of the upper right edge of the form, 9, 10, 11, and 12. The employer name in 10 where your fax number, that is the most crucial part of that form. You need to check every time and make sure they've got your information in there, because you should be the first one to receive this form. The adjuster usually will get their copy when the medical billing comes in, and that might be 5 to 10 days. They're supposed to file it within 10 days with the adjuster. But as the employer, you should be receiving this first, and this should stimulate whether or not you're going to follow DWIC 6. So on the field 10 where it says fax number, make sure that they have the correct fax number or the email address that you want this sent to. I would always encourage that you use a fax number as much as possible, because if someone leaves in their email address, we had a situation yesterday that came up, is that they said they weren't receiving the DWIC 73s, and when we looked at the DWIC 73s, it had the email address of a former employee. So you want to make certain that you can get these forms, because they are important for your return to work program. When you go down to section 2, the work status information, you've got the doctor has 3 options. And the first one, of course, is the one we want to see. We want to see them returning to work without restrictions. If they return to work without restrictions, that means nothing will be filled out in section 3. Nothing at all. Because if anything is checked off in section 3, at anything, then it's not a full release. So when you hit, it should be very clean. If they check off A under field 13, there will be nothing filled in 3. It should go straight down to where the next appointment might be, and all the information down there. If B is checked, now this really drives to our return to work program as far as bringing people back on modified duty. If it says that they have to return to, they can return to work, but they have restrictions, that's when it activates part 3. And everything in part 3 then that's checked needs to be closely scrutinized to see if you're able to offer them light duty. And I would strongly recommend that you stick strictly to this in order to be able to provide a bona fide offer, and you attach the DWIC 73 to your bona fide offer, and you make it be very specific to the time frame in which they're able to do modified work. If they check part C, which says that they're off work, what is usually missing, and I have a couple of counties that really want to know why this is not filled out. It says the following describes how the injury prevents the employee from returning to work. That information is missing. Remember, this form is for you. You have the right to contact the provider's office and ask that question. Why didn't you fill out this portion of the form? Now, you can certainly have your adjuster do it. Many times we have nurse case managers that are involved, and they can do it as well. But you have every right to pick the phone up and call them and say, thank you for this form, but we didn't get all the information we needed. Can someone look into this for us? I don't want you to hesitate to do that. You certainly can rely on your claims team to do that, or contact me as well. But you do have the right to pick up the phone. I would encourage you to actually have a relationship with your providers that are utilizing, that are treating your employees, the treating doctors. I think you have a better opportunity to do that if you're utilizing the network doctors and you're utilizing clinics. If you're not mandatory to utilizing the alliance physicians, hopefully you're in an area that's small enough where you can build a relationship with whatever treating doctor that's accepting workers' compensation, so you can get what you need so you can do your bona fide offers. And then down at the bottom where the follow-up appointment information, one thing to scrutinize as well is that the next appointment needs to be consistent with what's put in section 2. If they have been taken off work for a period of time or they're on light duty, that those dates need to kind of coincide, so that when they go back to work, when they go back to their appointment, then that's the end of that disability period. They can go back to the doctor, and then they have to restart it with a new DWIC 73. If you have any questions on how this needs to be filled out, please do not hesitate to contact me. I can give you some guidance on that. I have been speaking with our Alliance provider liaison. Her name is Teresa Gonzalez, about ensuring that we're getting what we need. We've had a couple of our members who've been very astute and have been asking about, getting better formatting and better responses on the DWIC 73, and I certainly appreciate that, bringing that to our attention. And we're hoping that they're going to be kind of diving into those areas. I understand that Texas Municipal League and Texas Association of School Boards have been having some similar issues as well. So I think that we're going to be seeing the Alliance putting some more focus on that in the future. The next screen, it basically is just going to remind you that we talk about presumption. The treating physician has presumptive weight for recommendations of disability dates and treatment. As much as you would like to be able to say, I don't understand why they can't come back to a sedentary position, the doctor has the final say-so on that. Now, the decision and the opinion of the treating doctor, particularly with network doctors, we can't really move Denmark. We can ask questions, but we can't push them to do anything. That would be inappropriate, because under the Texas Workers' Compensation Act, adjusters and employers, we do not have any medical authority to push anybody to do anything. We can't direct care. We can only assist an employee to get to a doctor, but we can't do anything outside of that, other than try to engage with our nurse case managers and have them engage with the medical personnel. So the treating doctor has presumptive weight, and that DWIC 73 is really their position on it. Generally, we rarely see changes within the disability period. We may have to get to the next doctor's office in order to see any change if we want to have any impact on it. I did mention to you carefully, I said look at that 73 carefully, make sure you've got your fax number or your contact information on there. We do recommend that you use a bona fide offer and support it by that 73, and engage in a relationship with all of your healthcare providers. Don't feel hesitant to do that. If you have somebody that's not working with you and they're part of the network, let me know and we'll see if we can do some intervention on that. Okay, our DWIC update's really not going to change much from what we talked about last month. Audit still going on with the libs and the death benefits. Performance-based oversight is going to end in 2 weeks, thank goodness. And you're probably going to see a less panic hearing from the adjusters about getting wage information and things like that, because a lot of that is driven by PBO, although they should be doing it all the time afterwards, and they're going to be held to a standard, something that we are working on in-house right now to make certain that we're seeing a higher quality of work. I think if you've been working directly with adjusters, you may have noticed we've seen a turnover in adjusters. Hopefully that's going to translate into higher quality work, more communication, and if you're not getting that, be sure and let me know. I also want to mention that the work comp conference, which is kind of, encourage employers to attend that can, even though it seems to be quite expensive this year. It's still accepting, applications to attend. So I wanted to put that up on your screen to let you know that that is an option for you if you're interested in attending at that level. And really, that brings me to the end of my presentation today. Does anybody have any questions? If not, I'm going to turn it over to Lee.
Okay, I'm going to give it just a minute just to see if anybody has any questions that they're typing in and we just don't see it. But I am going to go ahead and put in the chat a link to the registrations for this series. As Helena mentioned, we are doing this series every third Wednesday of the month until the end of this year. So those registration dates are on that link that I just put up there. If you have not already registered for the upcoming dates, please feel free to do that. You can register now. And we will be back here again on July 15th. So thanks everyone for your participation, and we really appreciate you.